David, thanks for joining me today to talk about the Dreadnought unit. I know our members in Scotland and Northern Ireland have been having trouble accessing the Dreadnought and the services that previously they had available to them, but that Nautilus has been campaigning on it for a long time and we've made some progress. So I suppose first of all, very briefly for those who don't know, what is the Dreadnought unit and what is it supposed to deliver for seafarers?
So the Dreadnought unit is a specialist unit under Guy's and St Thomas's Hospital. It was previously a standalone unit. It's now treatment within the hospital itself, but essentially the purpose is to provide priority treatment for seafarers, recognising the specific needs that seafarers have, and most importantly, they need to be treated quickly so they can get back to their careers at sea and keep their medical certificates valid for sea service.
Yeah, and it was a UK-wide service, and there have been issues for some members in recent years. So when does that start and who's been affected by that?
Yes, so this is, it's been dragging on a few years now. It's to do with the funding model of the NHS. Previously there was specific funds set aside for funding of the Dreadnought services, but as the funding models of the NHS have changed, essentially now what happens is if somebody receives treatment outside of their local area, the place where they receive treatment has to charge the money back to their local authority. So this is not a problem in England and Wales, but it is a problem in Scotland and Northern Ireland, mainly to do with the fact that health is devolved in those countries, and it causes complications with sending the money backwards and forwards. So essentially we're now in a situation where seafarers from Scotland and Northern Ireland are unable to receive treatment at Dreadnought because Guy's and St Thomas's Hospital Trust will not be refunded for that treatment. So we've been working very hard to try and resolve those issues, but it has taken quite some time.
Yeah, so I know that's been quite a long process, but you've made some progress on that now and towards getting that treatment back, timely treatment for people who need it. So yeah, where are we up to now and what's happened with it?
So as I say, we've spent quite some time trying to resolve this issue. It's basically we've had to escalate through all of the various levels in order to get some positive feedback, but essentially we've taken the issue to the highest levels within government. We've spoken to DFT and MCA, and after those conversations we were able to put forward a proposal to the shipping minister in order to resolve the situation. So the outcome from that is that the shipping minister has recognised that priority treatment for seafarers is an issue the government supports. They recognise that there are issues with the service as it stands, and they agree that those issues need to be resolved. So essentially what's been proposed is that MCA and DFT will work towards implementing devolved Dreadnought services in Scotland and Northern Ireland. So they'd run under the Scottish and Northern Irish health authorities. So that would resolve the funding issues, but then seafarers should be able to receive the priority treatment in those areas.
Yeah, and as I understand it, some people were applying for, even in England, were applying for Dreadnought services and were still not receiving priority because the doctors who were supposed to be treating them didn't understand exactly why they needed to be at the front of the queue. And I think some of this will also help resolve things for them, is that right?
Yeah, I think we've recognised that since the pandemic, when services were suspended, since they've been reinstated, that seafarers in England and Wales also haven't been receiving the service that they would hope to. So as part of our negotiations with the Department for Transport and MCA, we have ensured that that's taken into account, and that the actual definition of what a priority service is something that should be addressed, and that again has been agreed upon by the Minister, and we'll be looking to ensure that with that definition we can therefore hold those delivering the service to account and ensure that they're delivering the service that they're supposed to be.
Great, so I know it's been a big effort, and as you say, it's at the really highest levels of government, at the ministerial level, so it's taken a lot of time, but also, you know, that's really important that we've got to this point. They've recognised that. Where do we go from here, you know, to make sure that people can get the treatment in future?
Yeah, as you say, it's taken quite a long time to get where we are. It will still be a very complicated process in order to set up these devolved services. There's the added complication that it's going to require coordination between those responsible for transport policy and those responsible for health policy, with health being devolved in those nations and transport not being devolved, so that there are still significant hurdles that will need to be addressed. But as you say, we have had confirmation from government that they recognise the need for the priority service, and they recognise the issues, and they are committed to ensuring that there's a resolution.
Yeah, and that's great, because another option could have been for them to not recognise that and potentially scrap it. So it's really good that it's going to be preserved for the future. So yeah, I wish you all the best of luck with the future lobbying, and I'm sure we'll have an update for members as it proceeds.
Thank you.